Good morning. My name is Ada Skiles, and I'm the Associate Director at Chapin Hall. We'd like to welcome you today to our Child and Family Policy Forum. On behalf of Chapin Hall, I'd like to thank those of you who braved the weather and came out to be with us today. And I would also like to thank those of you who are joining us on our live webcast. Today's program is entitled Collective Impact to Address Social Challenges, the Role of the Nonprofit Sector. I know you will find today's conversation both lively and informative. Moderating our panel of experts is Deborah Darrow, Senior Research Fellow at Chapin Hall at the University of Chicago. Again, thank you very much for taking the time to participate with us today. And now I'll turn the program over to Deb, who will introduce our panel to you.
Thanks so much, Ada. We're delighted to have those of you that have joined us in the room. As Ada said, you are indeed very brave. And also for those of you that are joining us online. As we outlined in the announcement for this event, we believe that achieving better outcomes for children and families and the communities in which they live requires some new thinking in how we conceptualize, address, and finance our interventions and formulate our policy. Silo thinking in the next generation is not going to get the job done. New collective efforts are needed across disciplines, across agencies, and across sectors. It's not just the public delivery of services, but it's also the work of the nonprofit sector that's becoming increasingly important. Our first three speakers today all understand the importance of changing the way we work and have invested in exciting innovations to advance collective impact within their respective organizations. All of them are true leaders in their field, and they get the task at hand. It's not just about them being successful or their organization being successful. It's about creating an environment where we realize unless we all succeed, none of us will succeed. There are full descriptions of each presenter in your material, so I won't go into detail, but just to briefly introduce our first three speakers today. Diana Rauner is the president of the Ounce of Prevention Fund here in Chicago, a leader in early childhood, both here in Illinois and nationally. Joe Kavanagh is the CEO of Family Life, a community change and empowerment organization based in Melbourne, Australia. I had the pleasure of working with Joe this last fall and really examining the interesting things they're doing in her country, and I'm delighted that she can join us, despite American Airlines. Richard Jones is the Senior Vice President of Community Investment, United Way of Metropolitan Chicago, which is one of the city's leading organizations in improving the quality and the impact of the nonprofit sector. In preparation for today, I asked each of these three speakers to talk about four questions. What's the most innovative strategy that you're implementing right now? What's the most unique aspect of the work that you're doing? How's it going? What are you learning? What challenges do you see ahead? And then finally, what really will you need to do different in order to take this work, this innovation, to the next level? Following these three presentations, Ann Cohen-Donnelly, from a senior lecturer at the Kellogg School of Management at Northwestern, will serve as a discussant and give us some insights into what the panel presented and to stimulate our thinking both here and online. Ann brings a combined perspective of both scholar and doer. For many years, she was the executive director of the National Committee to Prevent Child Abuse here in Chicago, where she exhibited extraordinary leadership and vision. For those of you who are online, please remember that you can send questions and contribute to the webcast using Twitter, as Ada said, with the hashtag little symbol there, Chapin Forum, posting questions on the UC Live Facebook page, or sending an email to policyforum, one word, at UChicago, at chapinhall.org. I'm going to begin now with Diana's comments.
Thank you, Deb. Good morning. So I'm going to talk about a particular part of our work at the Ounce of Prevention Fund that has been an ongoing learning process for us over the last really 20 years. and that it takes up certainly a good portion of my time and our organization's focus. It's the Educare Learning Network. But let me start by beginning with what the problem is that we are really most specifically trying to address. This is a slide which shows from our own very own Professor Heckman at the University of Chicago. It's one of many slides that demonstrates the persistence of the achievement gap. And this one shows achievement by quartiles of maternal education. We could put a similar slide up for income. It would look exactly the same. The essential and most important part of this slide is the fact that the achievement gap is very, very apparent by age 3, and fundamentally, from a systemic point of view, doesn't really move through formal schooling. And what it suggests is that if we're going to address the achievement gap, we're going to have to do it before age 3. And that's really the focus and purpose of our organization, and has been since our founding in 1982. A little bit of history, a story. These, for those of you who are new to Chicago, this is a photograph of the Robert Taylor homes in the Grand Boulevard community. At the time that we worked there, it was the poorest census tract in the United States. And as part of our ongoing examination into what it takes to help children arrive at school, at kindergarten, ready to learn, we began a project there in the mid-'80s that was deemed the Beethoven Project, because Beethoven was one of the feeder schools for the Robert Taylor homes, just on 47th and State. And the Beethoven Project was an attempt really to surround the children that would be attending Beethoven with every kind of support, material, emotional, and educational, that essentially that middle class families had. It was a simple approach to how do we help these children be ready for kindergarten? We give them everything that your children got. And that meant that we did a lot of different things. We ran programs for mothers. Of course, this was during a different structured time when there were a lot of moms at home. We ran drop-in counseling. We ran nutrition. We had play groups. We had a variety of activities going on. A lot of them were innovative. A lot of them were good ideas that we tried out, and we tried to see if they would work. And then along came this woman from the University of Chicago, Deb Darrow, to do an evaluation. And guess what? We were generating a lot of heat. We were doing a lot of hard work, and we really weren't getting outcomes on the kids. And that's a hard thing to hear when you've been spending years and millions of dollars, public and private dollars, doing this work. But I think the test of an organization is when you get bad news, when you get data, what do you do with it? What we did was we asked Deb to join our board, and we shut the program down and went back to square one. It was also a time when welfare reform was changing the dynamics of this community, changing the dynamics or the economics for mothers of young children, and the changes in CHA were actually changing the dynamics of this community. So the Robert Taylor homes were coming down. We spent time really looking at what innovative practices, what were the best practices, what was getting results across the country. We did a lot of focus groups with parents. We tried to understand the economics of early childhood, of the Byzantine funding streams that feed into early childhood, Head Start, the nascent early Head Start, state pre-K, childcare. And we built something called Educare of Chicago, on an empty space of land between what was then Farron Elementary School and DuSable High School on 51st and Wabash. This was built on CPS land with state funding, private funding, and federal funding. It was the very first time that Head Start had actually ever given money for new construction, which is pretty mind-boggling if you think about it. It was, from the get-go, meant to be a public-private partnership. So it was a partnership of the Chicago Public Schools, of the essentially the State Board of Education and the State Department of Human Services, and the Irving Harris Foundation, as the anchor philanthropist and the Ounce of Prevention Fund as the Head Start provider. And the goal here really was to have a truly operating partnership of those different entities. So not just a funding partnership that builds the building, but actually a partnership that is both responsible for and to the program going forward. And that was really our first foray. Now, we were kind of burned at this point because we'd already gotten some bad news. And so we really didn't open this and say, look, this is great. We're doing really well. In fact, though, it was one of the first purpose-built Birth to Five. It was the first purpose-built Birth to Five center around for quite a while. And so people came from all over to come see it. Some people came and said, nice building, lousy program. That's what Ron Lally said. And he said, you need to practice continuity of care. So we actually retooled and we practiced continuity of care, which is keeping babies and caregivers together for the first 3 years. Other folks came through and said, this is fantastic. We want to do one of these in our community. And we said, well, we don't really know what we're doing. So really, it would probably be best if you don't try to replicate what we're doing, but we will partner with you and we'll learn together. If you want to build one, we'll learn together. Do what we're doing. Let's gather the same amount of data and let's start learning from each other. One of the things that we learned from our Beethoven experience was to be obsessive about data, to ensure that we understood how our kids were doing, what was going on in the program, and to be able to look at and document outcomes on kids. We understood that one of our challenges in the Beethoven Project had been that we had really not had the intensity and evidence-based practices that we needed to really see changes in the kids. So we created what we called an Educare Learning Network. Our first partner, and really our foundational partner, was the Buffett Early Childhood Fund, which was a partnership of Susan and Peter Buffett, two of Warren Buffett's children. And they built Educares in Omaha, Nebraska, and Milwaukee. 10 years later, we have 18 Educares open across the country and another 4 under development or construction. And we call this an Educare Learning Network, and we really mean it's a learning network. Each Educare is a true to form is a partnership between a local philanthropist, a local school district, and a Head Start, an early Head Start provider. It's usually a nonprofit. They are all dependent on both public funding streams and some private philanthropy. And they are required, as part of being part of our network, to collect a standard set of data on the programs and on the kids, which we get together and review every year. Every year we stand up and we put our data up against other people's data. And that becomes one of the ways that we keep track of whether we're all doing what we say we're doing and how we're all doing. What we've learned from our work is that, in fact, this intensive, high-quality Birth to Five learning experience does work. It delivers children to the kindergarten classroom at national norms, basically, on important measures of vocabulary, social emotional development, and conceptual development. So that's all the great news, and we're very, very proud of that. But it doesn't really begin to answer the biggest question, which is how do we do this for more children and for all children? This is not meant, the goal here is not to cover the map with dots to a point where there's an Educare on every school, on every corner, because these are expensive undertakings, not just because they're purpose-built facilities, but because they are research and data intensive, and because creating a partnership between a school district and philanthropist and a Head Start provider is, that in and of itself is a huge amount of work. So really, how do we use this to really have collective impact? A couple of ways. First of all, one of the things that we're really trying to do is build a workforce and leadership in a really fragmented field. The early childhood community is, unlike the K-12 community, is deeply underinvested from a human capital perspective, deeply underinvested from a curricular, from an outcomes perspective. There really is not a lot of coherence from a field perspective in terms of what do we do to improve student outcomes? What do we do to to deliver high quality practices. It's not that people don't understand what high quality looks like. It's just really hard in a workforce that's so underpaid and undereducated to do that on the ground. So one of the most important things we're doing is building leadership, building evidence and experience in how to improve classroom quality, and using that as a way to feed out to the many communities that we're now in across the country. The other thing that we use this, and one of the most important things we use this for, the EduCare Network for, is a showroom for quality. And, you know, this may seem kind of silly to you, that it matters whether, you know, David Brooks or, you know, Cory Booker comes through in EduCare, but it actually means a lot. One of the things that I am most proud of is going to a conference in California and hearing David Brooks say to a room of hundreds that of all the research that he's read, the most important learning he did was on an early childhood program on the south side of Chicago. Seeing is believing. For people who don't actually think about birth to 3 education in particular, being able to see what it looks like, being able to understand brain development by seeing examples of really high quality teacher-child interaction, high quality teacher-parent interaction, beginning to understand in a very, you know, in the most experiential way why this work is important, has been for us one of the most transformational opportunities of the EduCare Network. And so the public-private partnership helps bring these kinds of people in the door because they come because they're asked and invited by important and powerful people. And I'm sorry to tell you that that's how the world works. So that's one of the important things that we use EduCare for. And the other thing that we've been able to do with EduCare is really draw connections between high quality early learning in the classroom setting and what that means for policy change. So our EduCares are really meant to be beachheads of quality that start to talk about what kinds of policy changes, what kinds of funding is needed in order to bring this kind of quality to children, to all children across the country. And so we are very, very excited, for example, that President Obama has come up and come out with a $75 billion birth to 5 program in his State of the Union address. This is not an accident. We don't take credit for it, but we also know that it's the result of years and years and years of hard work. So that gets to kind of, well, so what's our biggest challenge? So the biggest challenge is scale. In our field, the biggest challenge is scale. It's how to take a fragmented and invested market and begin to change at some huge pace, the quality and the access to quality in our field. Right now, for infants and toddlers, approximately 4% of eligible infants and toddlers that is eligible for Head Start are receiving early Head Start. I don't know if any of you saw the New Republic article that just came out, Jonathan Cohen's article on the tragedy of daycare, but that is really the reality for most low-income children. It is children who are in settings that are not only are they not conducive to educational development. In some cases, they're harmful. In some cases, they're actually delaying these children's development. And so it's no surprise that we continue to see children in vast scales entering kindergarten so far behind their middle-class peers because so many of them are in these really, really unsafe and really unsupportive environments. So that is really one of our biggest challenges. I would say another huge challenge for us is around developing outcomes that the entire field can measure and embrace and explain. We all know that that it's relatively easy to test content, much, much harder to test skills. And a lot of what goes on in early childhood is skill development, even more than content knowledge. And those are really tough things to measure. So continuing again, this is Professor Heckman's number. Every dollar we invest in high quality early childhood education can save more than $7 later on. We know that to be true when the programs are really good. When the programs aren't good, it's not. So delivering on the promise, that's our biggest challenge. I think I'll stop there.
Well, good morning, everyone. You'll guess by my accent, I'm the Australian in the crew. I'm very delighted to be here and to have had this invitation from Deb. It also gives me an opportunity to acknowledge what a fantastic contribution Deb made in Australia when she visited with us last year, and to have her as a keynote speaker at a conference of which I was chair. It was just fantastic. And the opportunity to bring our knowledge together across the ocean and learn from each other, I think, is a wonderful opportunity. So I am delighted to be here today. I'm going to be talking about our Community Impact Statement project, which is for describing the social and economic benefits which can be created by investing in strengthening families, and particularly vulnerable families. It's actually about trying to simplify complexity, which of course is the other challenge Deb has given me here today, to do that in 10 minutes, having been working on this for over 10 years. However, I think all of us will be committed, and from Diana's presentation, to the same big vision, a vision where vulnerable families get what they need to care for their children, to live safely and well in their families. So the context is one where we see the challenge as growing awareness to change public, government and funder focus on prevention and early intervention, like in the early years, for improving the well-being of more children, and particularly the most vulnerable children. So in simple terms, what we're wanting to do with our project, and as an organisation and a sector, is to grow the investment in strengthening families to prevent the need for child protection and out-of-home care placements of children, or substitute care, I think it's more called here. And why do we want to do that? Well, because we actually do know how to do better. We do have evidence and practice that tells us we can do better for children. And children's developmental clocks are ticking. It's urgent for today's children that we stop repeating the mistakes. In Australia in recent years, you may have heard of a trilogy of parliamentary reports leading to national apologies that have been given to the stolen generation, our Aboriginal children who were removed from their families, to the migrant children, the children who were sent out during the war, who were taken from their families and sent from England to Australia, and the forgotten Australians, who are the children of the past who grew up in out-of-home care and were poorly treated and separated from their families. And even more recently, just a couple of weeks ago, our Prime Minister gave the apology to those affected by forced adoptions during the 50s and 60s, where children were taken from their single-parent mothers. So it's a pretty long history of tragedy and lifetimes of trauma and pain, which have to be prevented for the future. And in Australia, when you think that we still have increasing child protection notifications and placements of children in care, and we also know that the outcomes for the children who grow up in out-of-home care, which includes an overrepresentation of our Aboriginal children, they have the poorest outcomes of children in our community. So, put simply, that's not good enough. And over my 35 years plus working in this sector, it's very clear to me that what we need to do is be preventing the need for child protection and for children to go into out-of-home care. So how are we trying to affect this change? Well, we've got to the point of saying what we actually need to be able to do is develop the business case for change by measuring and articulating the social and economic benefits of effective efforts for strengthening vulnerable families. We've called it a community impact statement. And I don't know if you have here sort of the equivalent in terms of environmental or victim impact statements that are used, which I think is our growing community understanding that there are costs associated with some actions or with inaction. And we need to articulate those costs as part of our decision making in building our systems and be able to identify which are the efforts which return the best outcomes at a justifiable cost. And we need those impact statements to be systematised, standardised, and as regular and as expected of transparent and accountable non-profits delivering annual financial statements. It's interesting, isn't it, that we're very well developed in making annual statements about the money, but not about the difference it makes. So that's the gap we're seeking to close. So in answering Deb's questions and thinking about our community impact statement as innovation, we really want to stress that we're developing an evidence-informed business case. So it starts bottom up, working on the results that can be documented through individual program evaluations and integrating our program evaluations with what we learn from the wider knowledge base, randomised controlled trials, evaluations, research reports, to develop an evidence-informed theory of change. Not sure whether theory of change is familiar to everyone in the room, but we really want to stress the need for it to be an evidence-informed theory of change. If we believe certain things can happen, on what basis, what knowledge do we have for forecasting longer-term impacts into the future? And our argument is that we need to be able to assess and articulate the value of our impact for solving and preventing the high-cost long-term problems like child abuse and neglect, family violence and mental illness. To increase investment in family strengthening prevention and early intervention efforts, we need to prove that they work in the short term, demonstrate the sustainable impact over the intermediate term, so for how many people do the changes persist, and that they will have sufficient long-term impacts to justify and in fact encourage the impetus for investment. So that takes us into a forecasting the likely and believable contributions to changing high-cost social problems with a very careful application of the social return on investment calculation. We're not interested in the final number that is used for those who are familiar with social return on investment. We're more interested in the break-even analysis and the value creation of effective prevention programs to forecast savings and contributions. So if I just give you an example, and I'm glad that it lines up with Diana's talk on the early years, we have an innovative program called Community Bubs, as in babies, that is a home visitation program for vulnerable parents and babies. And we've been running that for 10 years. It has delivered no less than 80% achievement of case goals and children living safely in the care of their families at case closure every year for 10 years. At the cost of $100,000, we know for 15 we can serve 15 families, and we only need to prevent 3 families out of the 15 entering or needing the child protection system, and that program has actually paid for itself. It's broken even. We know that an episode of child protection and a foster care placement, just an episode, is on average a $45,000 cost. You could give a family 3 episodes of a home visitation program and you're still ahead. Over the years, when you forecast out and model out, so what's that worth to the service system? And we know, looking at over our 10 years, the numbers of families that have successfully completed the program with sustained, ethical and effective practice. We're looking at millions of dollars that are potentially being saved, because we also know that the cost of a child going into out-of-home care is around $175,000 a year without all the treatment services on top of that. And that's a repeating annual cost. So being able to make a statement that puts the good sense on the table about the value that's created in children doing well and like children starting school well, able to learn, and the costs that will be saved into the future, it's important that we develop a way of communicating that information. So that means that in trying to develop this as a shared tool, we need to have common measures and be working towards common outcomes and be able to aggregate the data for the collective impact. So what does that mean, not just for family lives programs, but across all similar types of intervention? So scaling impact rather than necessarily repeating the model, but being able to demonstrate the results and scale the impact. One of the things that we've learned is accurate data requires practitioners. I love this quote from one of our team leaders who was involved in the rounds of us practicing this methodology for doing the evaluation into the impact analysis. She says, "I believe in what I do every day. I know I can help people and make a difference in their lives. Learning the community impact statement process was a challenge. But then I had this wow light bulb moment when I saw it laid out in front of me that I was part of something much bigger, that what I do helps make these bigger things, long-term outcomes happen. That was such a great moment, and I get it. Why we need to not only be professional and planned as we apply our knowledge into practice, but we also need to collect the right data and measure the short and longer-term outcomes of our practice. We need to be able to tell the bigger story." And it has been a joy that all the practitioners that we've worked with in the 22 repetitions across 3 large organisations and 11 different programs, we've had the same response from the practitioners, and their motivation to get the feedback about what they're doing and that that's working and be able to be confident in their practice, as well as then be part of the advocacy process in developing impact statements, has been a great motivator to keep going. So this is what it looks like in terms of our national project, and we have over in New South Wales Catholic Care who've been working with us, Anglicare from Western Australia, and they actually have particularly included programs with Aboriginal families up in the remote northwest, right up the top there, not far from Darwin, which is where we had our national conference last year, and Deb was involved. So we're looking at how we take this to scale as a mechanism and a methodology that we will use across family support agencies around the country. So the challenges I think that we're facing with is the leadership for connecting up the community impact. Trying to encourage people to see that they're part of, it's not my program against your program, but we need to look at effective practice, and we had a little conversation about this earlier, rather than getting obsessed perhaps with models, because what we need to do is know what actually works and that it's ethical quality practice that is delivering on the outcomes. And how are we going to get there if we can't come to the table together and be prepared to own our contribution to the outcome with our colleagues? I suspect that that's actually easier for practitioners to do and more of a challenge for CEOs. CEOs who need to demonstrate to boards that their organisation is doing well and is financially viable and are competing for funding with other organisations. It's actually a challenge for CEOs, I think, to step up into the what are we part of rather than what do we actually do. And I think that's one of the really big leadership challenges that our boards and governments need and funding bodies need to help us with in terms of requiring the collective contribution to be articulated. I think it's a big challenge, but I think that history's on our side, and I think when Margaret Mead said this quite some time ago, never doubt a group of concerned citizens can change the world. Indeed, is the only thing which ever has. And I think it does come back to people and how we work together and share our knowledge and get a common language, common outcomes, shared measures, but also really respect our practitioners and our workforce and really be able to articulate the case of the difference that their day-to-day work makes for individual families, as well as for the big ticket issues that our societies are grappling with, and we can't do it without the practitioners to do the work and collect the data so that we can use it to be making our business cases. I thought it was interesting to read this week that Bridgespan, the think tank group here in the US, has published some research findings that says donors say that NGO leaders have not made the case for investing in platforms and transforming networks, nor can they demonstrate the results. My heart sinks when I read things like that, because I think we do such great work, but we haven't made the case effectively enough for everyone to hear it. At the same time, Nell Edgington from the group Social Velocity has published an article saying, it's time for a new kind of non-profit leader, one who has the confidence, ability, foresight, energy and strength of will to really lead the non-profit sector forward. This new non-profit leader needs to move to impact. She realises that it is no longer enough to just do good work. Non-profits must create a theory of change and then find a way to measure and articulate the outcomes and impact they hope they are achieving. Well, from this not so new non-profit leader, I do think we're well on the way, as this forum demonstrates, and I think will help to contribute towards us understanding what we can all do and all use together to make the collective impact statements to strengthen families so they get what they need for all children to do well. Thank you.
Good morning. I'm going to approach this subject from a different kind of angle and take more of a system perspective and really talk about United Way in the context of not only United Way of Metropolitan Chicago, but talk about our relationship with United Way worldwide as well. And just as a part of that context, just keep in mind that United Way Worldwide actually raises over $4 billion a year through contributions because of the campaigns that are conducted not only here in the U.S., but also across in 46 countries around the world. And there was recognition recently that although we raise over $4 billion, we are seeing very limited progress as we look at a number of social issues like high rates of high school graduation, like individuals not having access to preventable health care, and also the fact that we still have an economic system where there are large numbers of our residents who are unemployed. So we decided that we need to reframe our work and really think about it in a very different way. And what United Ways are doing more of now, we are embracing the collective impact model, and I'm glad in your material that you have the Stanford article that was written in part by Mark Kramer. Mark Kramer has been retained by United Way Worldwide and is really helping us on this journey as we're making a transition from how we are currently viewed to a new road. I would just comment about that. The United Way here in Metropolitan Chicago, we have a vision that the Chicagoland area will create a community of thriving neighborhoods where individuals can actually realize as much of their potential as possible. We feel very strongly that in order to really get our arms around issues like poverty and some of the other challenges that we're facing, that we need to concentrate. So our theory of change is that we will concentrate our resources in the areas of income, health, and also education. In fact, by 2020, we are hopeful that we will help 50,000 underperforming middle school students enter high school ready to succeed and more likely to graduate. By 2020, 100,000 families will be connected to preventable health care, and over 200,000 families will have an opportunity to change their financial position in life. So we have these very bold and these very ambitious aspirations that really frame what we call the LU 2020 Impact Plan, which represents our major strategic investment in the community. To achieve the LU 2020 Impact Plan, the United Way has undertaken several actions. The first is that we're moving away from our role that most people associate with United Way as serving primarily as a fundraising organization. We're building that role out now to also take on the role of serving as a change agent, working with other organizations in a community impact model. That's number one. Second, we're going narrower and deeper in 40-plus communities of greatest need in the Chicagoland area, again, by really concentrating these areas of income, health, and education. Next, we are embracing, like United Ways across the country, the collective impact model, which I'll comment about further shortly. And finally, the United Way in Metropolitan Chicago is designating some of its financial resources toward the development of what we're calling the Live United Neighborhood Network. The Live United Neighborhood Network is an attempt on our part to really coordinate and deploy education, income, and health resources in a very specific geography. The Live United Neighborhood Network is founded on the principle that enormous progress can be made when information is shared, resources are coordinated, interests are aligned, and more partners are engaged in the planning and execution process around program services. The Live United Neighborhood Network has several elements. The first is we identify a community of greatest need, where there are few other social service resources and where there's an absence of a large coordinating body. Second, we select a proven and financially secure lead partner organization working in collaboration with many other organizations, both public and private, and also working with public schools that are delivering services in tandem with other organizations. Third, we seek to identify a stable school that has a proven track record, an exciting leader, and one that is well respected by the community. And fourth, what we tend to do is identify those schools that become a physical hub where we concentrate a number of resources that can be accessed by many residents in the community. In this model, the lead partner agency is responsible for the day-to-day coordination and program execution of a number of services that we are driving to deliver. United Way provides management oversight, capacity-enhancing resources. We provide financial support. We provide issue advocacy, access to a volunteer network, and also access to corporate partnerships to provide a range of sponsorships and other financial opportunities that support the network of services that we're trying to build out. Our first Live United Neighborhood Network is located in the Brighton Park community, the second fastest growing neighborhood among Chicago's 77 communities. This southwestern neighborhood of 45,000 residents has gone from a primarily Eastern European community to one which today is primarily Latino. There has been significant growth in a number of areas, including child poverty in Brighton Park. And Brighton Park remains one of the most medically underserved communities in Chicago today. The Brighton Park Neighborhood Council has been selected as our lead partner agency, working in collaboration with a host of other nonprofits, including the Center for Economic Progress. Services are provided through the council offices and 3 schools, including Shields Middle School, Davis Elementary, Burroughs, as well as, I'm missing one, Shields, Davis, Burroughs. Sarah, who am I missing? And Kelly, right. We have a number of objectives. We're trying to increase the number of early childhood slots. We're trying to increase parent engagement in students' educational development and achievement. We're looking at ways of increasing healthy behaviors and access to holistic health services. We're also striving to increase the number of households that are making strides towards becoming financially self-sufficient. We're also engaging in many coalition groups and partnerships that are focused on addressing a range of social issues currently challenging the community, including the exploding issue of community violence that is impacting many communities in the Chicagoland area. So that gives you a context. With respect to the questions that are being raised, what is the most innovative strategy that the United Way is currently engaged in, I have to say that the development of the Live United Neighborhood Network concept is our most innovative practice today that we are rolling out. As I indicated before, we have rolled out the Live United Network in Brighton Park. Our plans are to actually develop and implement 9 additional networks throughout Chicagoland over the next 5 years. What is the most unique aspect of this strategy? I think for someone like me, who's been part of the United Way for many years, I worked with the United Way in Boston in the 80s, I'm working with the United Way now in 2013, and what I have observed, we have this concept of United Way of talking about turning outward, that we are much more engaged in collaboration, we're much more engaged in building and participating in coalitions, we're much more engaged in community conversations in an all-out effort to be relevant and also in an all-out effort to really facilitate the development of large partnerships that are going to result in the addressing of major social issues that continue to challenge our community today. What is working well and what have you accomplished? The network in Brighton Park was launched in February 2013, so very recently. But what is exciting to me is to see the interest expressed on the part of the private sector. We have a number of businesses, a number of corporations that are interested in providing financial support to our Brighton Park initiative, and a number of those financial institutions are also interested and have expressed a willingness to support the further development of networks that we're planning for 9 other communities. I'm also excited that United Way is a member of a very active coalition in Brighton Park that consists of 8 schools, 5 churches, 5 social service organizations, elected public officials, and many, many service providers, and that we really are talking about real issues that are challenging the Brighton Park community and trying to explore strategies that can really address these issues. We have provided employment to over 25 community residents who are working in the classrooms as parent mentors and also as health promoters. With respect to challenges that we're facing, there are a number. I think one of the first challenges that we really are trying to sort through is realigning our new role, that of moving away from just being a funder only to being a change agent in the community, and realigning the perception that people have about the United Way and the role it can play in that kind of process. Second, there are a number of parallel initiatives that are underway in our community, Promise Neighborhoods. There are also a number of initiatives like New Communities. Educare is one, that Diana described. And I'm often asked the question, how are these initiatives different? So for me, the question becomes, how can we work together more effectively, given the limited resources that we have access to, and also given the scope and magnitude of the challenges that we are facing today? A third challenge I think we're facing really is on the evaluation front. I think we are extremely skilled at the United Way in terms of measuring individual and behavioral change. But the challenge for me is, how can we put together a kind of evaluation effort that clearly allows us to see what is the impact of our investment over time on the community? What are some major indicators that we can really point to that can say to our community that based on these investments, these are the changes that we have achieved through our collaborations, through our partnerships, and through the kinds of financial investments we are making in the community today? And then the fourth change to me is that recently there's a continuation of another big important effort in Chicago. Many of you here are very familiar with the Chicago Allies. And now that effort is being overseen by the city of Chicago. It's based on the Strive model out of Cincinnati, Ohio. The Strive model is really considered kind of the gold standard of collective impact models in our country today. They've been at it for over 7 years. And what's amazing is that they've had this incredible success at bringing public and private organizations together in the community and agreeing on several indicators that they will actually work on in a collaborative fashion over a long period of time. And they are reporting some very successful results. In fact, I was reviewing the most recent report, and of 34 key indicators of success that the community of Cincinnati and Covington, Kentucky have really agreed to focus on, they have actually met over 27 of those key indicators. So for me, the challenge that we have in Chicago is how can all of these collective impact partnerships that are emerging in our community come together? And how can we really create the kind of conversation and the kind of agreement that becomes a platform for success, for really making a difference in the lives of thousands of vulnerable children, youth, and families who count on all of our organizations every day. Thank you very much.
Good morning. How y'all doing? We've just heard some stories about how nonprofits, in partnership with other organizations, public, private, corporate, are spearheading some really important social change. What I'm going to talk about a little bit is, are these stories anomalies, or are they common stories that all of you confront? Is there an important role, in fact, for nonprofits to bring about social change? And can or should nonprofits actually be the catalysts, the leaders in bringing about that change? And if so, what are the challenges? How many of you know how many nonprofits there are in the United States? Over 1 million, probably a higher number. And of that million or so, more than a third, probably almost 50%, are nonprofit organizations that are concerned with community health, social issues, as well as human service issues. Nonprofits make up 8 to 9% of the gross national product in our country. They have a formidable presence. They're on the radar screen. Look at what nonprofits are capable of doing. We heard about 3 stories this morning. We think about social movements in our country, what happened with the anti-smoking drive, what happened with the drunk driving drive. And even today, sometimes nonprofits take us in directions we don't really want to see our country go, but think of what the NRA is doing with issues of gun control. Clearly, nonprofits can and do play important roles in creating and sustaining change. There are many reasons why. First of all, nonprofits can be flexible and nimble. They can call their own shots. They can be daring. They can take risks. They can set their own agendas. They are independent organizations, not dependent upon politics, to some extent legislation, and certainly the will of legislators. That's, in fact, why they've been created in our country, to be independent. They tend to be organizations that are mission-focused, that are based on passion. They involve people who are open-minded, willing to consider different points of view. They tend to be democratic, giving lots of people a voice, engaging a variety of interests in decision-making. They tend to be comfortable trying to influence public opinion. And finally, what is the purpose of nonprofits other than to serve the public interest, which usually means improving things from the way they are today, which implies change? In other words, nonprofits, all of us, are comfortable by nature being change agents. Government agencies, corporations tend not to be. So what does this mean in terms of nonprofits being leaders or catalysts of social change as opposed to participants? What are the challenges? Challenge number 1, in order to bring about social change, a nonprofit organization cannot do it alone. It needs to do it in partnership with others. And what does this mean? It means we have to share the pie. We have to share the pie with others rather than staking out our own self-interest, our own ground. It means we need to work with others we don't agree with, people we may not like, people we may not trust, and historically people we have competed with. It means we're called upon to compromise our views in order to accommodate the views of others. Hopefully it doesn't mean compromising our values, but it certainly means working with people of different professions, different areas of expertise, people who have different ways of getting things done. And even when you think about outcomes, as Joe and Richard have alluded to, it means trying to get people to agree on what it is we're trying to accomplish, or what are the things that actually make sense to us as we go forward. There's some other challenges that we face. The first has to do with the size of nonprofits. We tend to be small. I mean, there is United Way, but each individual United Way around the country and around the world actually tends to be a small organization. We tend not to have our finances in great shape. Most leaders of nonprofit organizations go to bed every night wondering how they're going to pay their bills tomorrow. And even if you get a $5 million 5-year grant and can do wonderful things, at the end of the 5 years, there's still that question about sustainability. How do we keep going? How do we keep our own organization alive? Related to that is the fact that nonprofits really, historically, have not been in the business of taking things to scale. We've heard from Diana about one effort to take things to scale, and we've heard from Joe about another. But it's not our usual approach. Usually we're comfortable setting up a program and serving 100 families as opposed to setting up social change, which allows all families needing a particular service to get it. We have issues related to governance. Nonprofit organizations have boards, which is very important for making sure we have resources coming in, for making sure we have a mission articulated, and making sure we focus on that mission. But the fact is, boards can get in the way. They can slow us down. If we have to take account of all the different perspectives of people on our boards, it takes some time to get things done. The same is true of the way we do our work. We're based, obviously, on an organization that want to engage a lot of different people in terms of what we do. That takes time because it takes process. Asking each one of you what you think, getting you in groups to talk about what you can agree to, and finally assembling large numbers of organizations and individuals to determine what we're going to get done and how we're going to get it done simply takes time. In corporate America, if I'm the boss and I want something to happen, I tell you to do it. Government has legislation to lean on. The legislation says this is what we have to do, and we're going to go do it. Because we're independent, because we are not fixed to those kinds of challenges, it's a little bit harder for us. Finally, nonprofit organizations tend not to have a lot of depth of leadership, in part because we're small and in part because of the way we do our work. So we see up here four incredible leaders in the nonprofit world who are taking charge of efforts and charge of organizations to move them forward. But typically, they don't have 2 or 3 people beneath them who are training for the job. So these are the faces. You are the faces of the work that's getting done. If you leave, who takes over? So if you have a major social change effort, and the leader of that effort actually has to or wants to go somewhere else to do something different, what keeps that organization moving forward? What keeps that social change movement actually happening? And of course, what's the biggest challenge of all? The biggest challenge of all is if we want to be leaders, if we want to be the catalyst for social change, we have to change ourselves. We have to think about our outcomes differently. We have to think about the way we work with other people differently. We have to think about how we create sustainability differently. And we actually have to do our day-to-day work in a different way. So the challenges are great. It requires us to think differently. But if you think about the power that we see going on behind these 3 organizations and the work we're doing, if we think about the collective power of the nonprofit sector in this country and now increasingly around the world, I think we have a chance to take on those challenges and to be the leaders of social change and not just a participant in social change. Those are the challenges I throw out to the 3 of you and actually to all of you in the audience today as well. Thank you.
I want to thank all the speakers. My mind is sort of swirling with details. We have questions now. Again, for those of you that are online, you can feel free to send us email questions, and we'll incorporate those into our discussion. But I want to open it up to anyone on the floor that has a particular question. We have a microphone that we will be circling around. So if someone can raise their hand and identify themselves, we'll bring you a microphone. Is there someone out? Yes, right here in the middle. Paige, if you can.
Good morning. Paul Anderson, historian of the private sector. I'd like to ask Dr. Rauner about the EduCare program. Is there a transition component to it? When a child reaches 5 or reaches 6, do you get a pat on the back and directions to the CPS, or do you get a reference to a charter school or a private school? Is there follow-up beyond the initial phase of that program?
That's a great question. Is this on? That's a great question and a very important one. We one of the things that we learned in our learning network, because we didn't think of it at the beginning, was when we followed our children out of EduCare, we found our first cohort was scattered to the winds in both good and bad quality public schools. So we quickly retooled, as we've done throughout this process, and began focusing on transition very, very intentionally, training our family support workers to help parents choose schools, whether they're charter, magnet, or neighborhood schools, that reflect the values and the things that the parents have learned at EduCare. And most recently, we've taken that work to a full partnership with the University of Chicago Urban Education Initiative and their 2 charter schools in our neighborhood. What we found across our network is that schools have worked in their own ways to make these kinds of connections and to support transitions. It's an extremely important part of the work. And again, it's part of being a learning network. We didn't know that as much when we started.
Great. We have a question from the, that's why I'm not reading my emails. I'm actually reading questions here. I want to, there's a question for Joe. What infrastructure or system does Family Life have in place to standardize program level outcomes, evaluations of the nonprofit programs? In other words, what are the common measures you have, and how do you get everybody on board?
Well, internally for Family Life, we have our own internal research and evaluation unit, and we're in the process of developing the program logics for all of our services, which are aligned to a high-level group of 5 outcomes, which actually are connected to the outcomes of a Productivity Commission report in Australia on the value and contribution of the charitable sector. And then we're working with colleagues at the national level of the national outcomes that have been developed for the National Framework for Protecting Australia's Children. And we have an important group called the Australian Research Alliance for Children and Youth, who have developed the national report card for measuring the well-being of children and young people in Australia. So what we're seeking to do is try and connect those things up and back down to practice in terms of the objectives of the actual services that are provided to families, and how do they connect into the community level and then the state and national level of outcomes that need to be achieved to move those report card indicators. So we want to see what's happening for families, but we want to know what's happening at the public policy level. And then to try and share the methodology and get everybody using common terms, we've put forward a social enterprise business model for taking the community impact statement process into an income earning business with online tools, so that community agencies will be able to share the methodology, and it will operate as a separate business unit looking to earn sufficient income through licence fees to maintain the methodology. And there's an important thing called a proxy library of the measures of the costs and benefits, which needs to be maintained independently and have that independently assessed through a third party. So that's what I was saying. It was a bit complex in terms of trying to simplify that. So it really is bringing together what you need to do to support your practitioners and being mindful and very planned in the work that they're doing and measuring the program outcomes, to your organisational community level outcomes that everyone needs to contribute, and that needs to articulate up in an architecture to the national outcomes.
Great. Is there another question here? Yep, this gentleman right here at the table. Remember just to say your name and where you're from.
I'm Rich Cazzola from Legal Assistance Foundation, LAF, in Chicago. And it's kind of a hard question. I remember in law school in 1980 reading about home health visiting and preventing child abuse. In 1980, I think it was like the first wave of research on it and how successful it could be. And your program in Australia demonstrates that. Is there any way to kind of get a handle on why, when there's something like that, with so many, I think, years of demonstrated efficacy, it just never seems to get taken to scale? I mean, there are programs, my understanding is, around the country that have been successful. And how is it that, I don't even know how what the research piece of that would be, but you have this thing that's been proven successful, and yet it seems in many communities that it's more difficult to get that kind of service now in the States than it was 10, 15, 20 years ago. So my question is, when you kind of have that kind of, good program, but never quite taken to anything close to scale, any thoughts on how to kind of get people to look back at something like that and try to take it to scale?
I'll just mention one thing about home visiting, and then I'll turn it back to the panel. It is very hard to replicate programs that work. We know that replication programs are producing outcomes at about less than half of what the randomized trials controls do. Why is that the case? I think part of it is we don't quite get the replication picture. There's issues of staff training and supervision, that once you get away from the primary developers of a program, you're working with a staff that needs to be educated not just on how to do their job, but why they're doing their job. So that's a huge challenge. Secondly, sustainable funding for programs, so that people are willing to continue to invest in programs at the level at which they got invested in when they were found to work. We seem to want to cut corners when we go to scale. Somehow, if you do it for more people, it should be half the cost. It doesn't always work that way. You have to continue to do the investment. And then I think also the more you go to scale, the more variability there is in the families and the communities and the children you're working with. And what we know is there's not a simple way, there's not a single way in which communities function, there's not a single way in which parents interact with their children. All of these things are very individually based, culturally based, contextually based. And so you need to do this dance between replicating programs the way we know they need to do in order to be of quality, or even measuring quality, but also leave yourself open for the possibility of innovation. Because every time you go into a new community, you're going to have to do some tweaking. And what we're uncertain about is what can we tweak and what's really the I-beam, the structural wall, the thing you can't move in a program. And we're still struggling to do that. And even when we have lots of money, and we currently now in the federal domain have a lot of money to do home-based interventions. States are getting grants upwards of several $1 million a year. It is very hard to find those agencies that can deliver the service of quality, which is why the nonprofit sector is so important. That's who's doing the heavy lifting in these programs. It's individual nonprofit organizations. And if they're not as strong and as robust as they need to be, address all the questions that Ann outlined, it's very hard for those programs to go to scale. And I'd like all of you to talk about that, because you all have to interact with organizations and make that decision. Where's the best bet for your replication efforts?
Well, I guess I would also just add that, the new money from the federal government is enormous, the money that's come out of the Affordable Care Act, but it's still, we're talking about a field which is massively underfunded. So we've known that these programs work. We've known that some of these early intervention programs work, and they're still funded at 1/20th of the amount that it would need to reach all the families that need them. So it's not surprising that the social service agencies, the community-based agencies that need to provide those services, don't have the wherewithal, the capacity within their organizations to serve them. It will be a long time before they are funded well enough and sustainably enough that they can really build the kind of capacity that they need to be able to do this. So we are right now in a period of overwhelming absorption of new dollars, but that's not surprising considering that very, very, very few states have any kind of infrastructure with which to receive and use those dollars effectively.
And I guess I would add the comment that I think the barriers to going to scale are largely a political and a public social norms issue, which is why we've become interested in the economic business case. At a political level, I don't know about here, but in Australia, whenever we've got an election, I actually don't hear child and family welfare as a key political issue that's being debated. Education and health get up there, but you certainly don't hear social welfare. And I think in the community, there's an underlying norm that questions the public responsibility for looking after other people's children as a sort of a social norm that gets in the way of generosity or can be put to one side when times are tough and there isn't spare cash to give for helping other people's children. So I think, you know, those two kind of things that affect how we think and then how decisions are made, which is why I'm now really convinced that the economic business case is really important, because even if people don't get the moral argument, if we can point out what it's costing the country to not make the investment and the value we actually create if we do make the investment, hence Obama's recent statement getting the early years issues, I think that's the way we have to go, and we haven't done that sufficiently to be able to take the effective programs to scale.
Just two comments I will make. And that first is, I think that as leaders, we have an obligation to really engage in as much issue advocacy as possible in our respective organizations, really educating both the public and private sector about not only the importance of our work, but also how our work really has an impact on the community as a whole. Second, I'm encouraged by some of the new initiatives that are really starting to emerge in Chicago. I referenced earlier that the mayor's office is now getting behind this new Strive model. And there's a national group that's called the Cradle to Career Network. And that's starting to get a lot of leverage and a lot of attention. I think it's our role to bring these best practices to some of the influence groups and influence leaders in our communities to talk about how they can really work and how they can make a difference. So we have a meeting that's coming up, I believe, next month. A number of you in the room are going to be a part of that. But that creates a opportunity and a forum for us to really work to ensure that best practices and models that are really working effectively are really incorporated into that planning process. As I indicated before, Cincinnati and Covington have really been very successful at this. Places like Albuquerque, New Mexico are experiencing tremendous success with this. Salt Lake City is experiencing incredible success with this. So there are examples around the country that we really can learn from as we apply some of these lessons to a much larger urban setting like Chicago.
Yeah. I'll say ditto to what each of my colleagues here have said. I think back to when we wanted to take the Hawaii Healthy Start model and take it national through the Healthy Families America approach. And we had the model. We had some semblance of research that proved it was effective. We knew what the critical elements happened to be. But as Deb said, once you go out to individual communities to implement a program like that, there's both a need and an interest in designing it for our own backyard, both because people in different communities are different, values are different, what is appropriate is different, and those things change over time, but also because we're a country of entrepreneurs. We love to create. We love to implement. We love to start something new. So if you give me your proven model, I want to change it before I put it into place. So those are some of the barriers. But I think there are two that probably outweigh all the others, and that is, in order to really bring about social change, we have to change values. So with something like Healthy Start, Healthy Families America, home visitation, we have to create a community of people who expect to get support when their new babies are born. That's the thing they're going to demand when their babies are right there, and they're right there with their new babies in the hospital. How do I get some support to get off to a good start? And secondly, we have to change the system. So, for example, with home visitation, we have to change hospitals so they are prepared to offer that to all new parents. They expect to do it. And if we don't make those two changes, I'm not sure how we can ever go to scale.
Yeah. Are there other questions? Yes, right over here.
Hi, my name is Carrie Reichert. I'm a public policy student at the University of Chicago, and I wanted to get the panel's thoughts on the challenge that nonprofits have of needing multiple funding streams and navigating that process of not compromising the organization's mission or focus as a result.
Well, that's a very, very long and painful conversation because one of the challenges in early childhood, of course, is that it's a very Byzantine and complex funding stream, and I'm convinced it's one of the reasons that the field has been so fragmented and that philanthropy has stayed away because it's just too confusing and no one can manage it. From an organizational perspective, it is one of the things that holds programs back, I think, from implementing innovative models and implementing high quality models because the funding streams, none of them alone are sufficient to deliver high quality programs, and so they need to be blended. And each funding stream comes with its own set of regulations and requirements. On top of that, I think there is also the challenge from a private funding stream of ensuring that you're taking dollars to follow a vision that you're able to articulate and continue to promote even when funders may have a new idea or get tired of your old ideas. One of the things that I think has allowed us to be successful has been the ongoing and constant support of a number of foundations who have stuck with our work for years and years. Obviously, the Buffett Early Childhood Fund, which has been a partner of ours for 10 years in the Educare Learning Network, but also another foundation, the Stone Foundation, that's been funding our follow-up study for 8 years. And again, longitudinal research takes a really long time, and foundations sometimes say, well, I did this for 2 years, now I want to do something else. So I think that is one of the greatest challenges, is keeping foundations excited about work that really takes a long time to learn and learn from.
Joe, Richard, you have any thoughts?
Well, it's certainly been an advantage for us to increase our funding streams, diversify our funding streams, as much as it's difficult to sometimes maintain those relationships. It often gives you good leverage. So we can speak to the state government and say to the state government, for every dollar they give us, we're getting another dollar from the federal government. No one wants to pay for everything on their own. We can say to our private donors, for every dollar we get from them, we match it with 2 from government. So people like to feel that's part of the scale and the collective impact, that everyone's contributing. No one has to do this on their own, and trying to build those social norms of children being everybody's responsibility, helping everybody to move forward is something we need to do as a community, and everybody needs to contribute. But of course, the other side to that is you need an infrastructure that actually manages those processes, and our sector hasn't been good at articulating again the business case of why we need to invest in our infrastructure in order to have solid systems and processes to do more than incremental change, but to actually do large-scale change because the systems to support it are so strong. So, it's again one of those things that's a balancing act, but I think that we're actually in a space where more private foundations and corporations and business see that it's part of their responsibility. They need a healthy, well-functioning community in order to do business, and we can leverage that and increase their contribution. So it's a challenge, but I think it's one that we need to really embrace and grow and leverage as much as we can.
Well, one of the things I'm really proud of at United Way, when we created the Live United Neighborhood Network, we had considerable discussion about what level of funding were we planning to actually provide these networks. And I'll use Brighton Park as the illustration since that's our first one. But our plan is we initially funded this initiative with $300,000 investment. And our plan is to actually raise that level of support to $1 million. And we are working, again, collaboratively with public and also private organizations, a number of corporations in order to really achieve that. But it's out of our commitment to ensuring that Brighton Park will have the kind of platform and foundation that it needs in order to sustain the programming that we know is needed over time in order to achieve the goals that I outlined. So I like the principles, I like the values the United Way is really articulating through this support, and I like the fact that we are in it for the long term. The reality for United Way, too, is United Way currently is raising about $50 million in Chicago through our campaign activity. Our aspiration by 2020 is that we will move from raising $50 million to raising $100 million. So we are having many discussions about how we will actually achieve that goal. Obviously, it will be through a combination of revenue streams, some of which will be complex just because of sources. Others will probably provide more discretion. But I think that's just the reality. Having been the president and CEO of Metropolitan Family Services for 13 years, I just recognize as I actually served in that role that funding streams are always going to be complex. That's just the nature of how it actually works. Mm-hmm. And I think part of the role of the CEO is to figure out how can you creatively navigate a lot of these opportunity streams, leverage those streams to the extent possible, and also create new opportunities on behalf of the missions that we're all striving to achieve. So I believe very strongly in the importance of policy work that we're engaged in, on the importance of the advocacy pieces we're involved in, but I also accept the reality that a lot of these streams are very complex. But the third point I want to make, I don't want us to forget there are efforts underway in Chicago and also at the state level. Jason Saul, many of you know, who's connected with Mission Measurement, is doing some interesting work with the state of Illinois to see if we cannot really develop a common language around outcomes so that we can really work from a common data kind of form. And I'm intrigued by the work. United Way is having a lot of discussion with Jason Saul ourselves about how we can actually participate in that process. But I just want to acknowledge that there are efforts underway to make much of this far less complex than it is today, so that we are creating a much more reasonable system for agencies to access.
I think back to 20 years ago, if you went to ask a donor for $100,000, they gave it to you, no strings attached. I think back to 20 years ago, if you asked for $100,000 and got it, you could kind of be guaranteed that that funding would come in for a long period of time. Things are so different today. You know, back then there may have been 60,000 nonprofits in the country. Today there are over 1 million. The competition is fierce. I think often funders say, well, you know, I'm only going to give you money for 2 years because I want to be fair and democratic, and then I can give more money to larger numbers of people. Or, you've been so successful with the money I've given you, let me give the money to someone else who's struggling. And those are the difficulties that we confront. But the other thing that I've noticed, and Diana kind of suggested this, is funders really want to be engaged. They want to be involved. 20 years ago, it was, here, take the money and run. And today it's like, I want to sit at the table. So engaging funders at the table, making them a part of the process, is one way of getting them to have buy-in, and providing them with a business case allows them to stay there, I think, for longer periods of time.
Yeah. Yes, right here. This is going to have to be our last question, unfortunately, so make it a very good question.
Oh, God.
Feel pressure? Your name, so we'll all know if you have failed. No.
Yeah, that's right. I'm John Mitchell from Children's Home and Aid. I have a question just about collective impact in general for sort of everyone on the panel. When I think about collective impact and new money that's brought to the table, if Children's Home and Aid and 4 other organizations have the chance to go for a new $1 million, and 5 of us will all do it together, I can really see the case for that, and I can completely see why it works in, say, Cincinnati or whatever. On the other hand, when I think about, well, I already have $1 million, that's mine, and now I'm going to go ahead and invite 4 other people to just take $800,000 of the money I already had, and I'll share it with them for a collective impact. I see a lot of potential difficulty and challenge there, not just for Children's Home Aid, but for anyone that might be in that spot. And I'm just sort of curious to see what examples are you familiar with that has worked with existing funding and what allowed it to happen, or conversely, what are the challenges to allowing that to happen?
That is an excellent question. And as the panel contemplates it, we have just a couple of minutes left. So if you have a sentence or two response, if you because that's great. It sounds good on paper, but when the rubber hits the road, when has that worked well? And if any of you have a quick example, that would be great.
I have to say, for me as a CEO, the ones that work well are where I have good relationships with the other CEOs and we can make it as uncomplicated as possible. So we have some funding grants where that allow us to employ a set number of staff, and we give some of the money to an Aboriginal agency and some of the money to a refugee agency for them to employ someone to work with us as a team on a children's mental health program. So we're working together to improve the mental health of children in a high-need neighbourhood and school. So at that level, I think it's still about relationships and whether you build credits of trust with each other and a language to deal with the tough stuff of when something's not working, that it's not personal, you're discussing the issue. So our core skills become really important, I think.
I'm going to give a different example. It's here in Illinois of the Illinois Early Learning Council, which, of course, Children's Home Aid has been a big part of. And this is a situation where collective impact really allowed for the building of social capital and trust and an expertise across an entire field that was, I would say, an added benefit beyond supporting individual organizations, really built something that could not have been done by just one organization.
Great. Quick question.
To me, it's about giving up power and control for mission and accomplishment. And I don't have a specific example to give you, although I know there are many, but that's what it's all about, really being willing to take your hands away from the table, put the money out there, and use the money for the things that collectively we care about. That's the challenge.
A good example would be, again, from Brighton Park, and Sarah and Chris know this example I'm going to cite. In our grant to Brighton Park, we carved out some funding for another organization, the Center for Economic Progress. The wonderful outcome there is that they prepared through a volunteer program the tax forms for a number of residents. It yielded $140,000 in new income. That was a real win and a real win-win for Brighton Park Neighborhood Council, a real win for Brighton Park, and a real win for the Center for Economic Progress.
Great. Those were great examples. I just want to, the slide is gone. But the comment that Joe put up from Margaret Mead, it really is, if we don't work on this together, there really is no real solution or no real progress. I want you to join me in thanking our panel for coming and presenting. It was wonderful. And also thanks to each of you. I know it was not an easy commute today, and we are so grateful that you joined us. And for those of you online, we thank you for your time.